Hi everyone, welcome to episode 2 of our A Beautiful Life mini-series. Today we're going to talk about ethics and integrity in the field of plastic surgery. This is something I am extremely passionate about. I think it's a very important topic, both for you as a patient, but also for those of you who are providers and doctors in the field. I think you'll find this very interesting and hopefully important as well. And so without further ado, let's get into it. All right, so let's discuss the topic of ethics and integrity in the field of plastic surgery. This is a topic that has personally evolved for me over the last 20 years. And it's something that I lecture a lot about with our medical students, with residents in our international conferences, etc. And it's a topic that I think deserves attention. And it doesn't matter whether you are you're a provider, whether you're a patient. I think we all need to understand what our responsibilities and roles are in the field of cosmetic and plastic surgery in order to ultimately do the right thing for our patients. So without further ado, let's discuss sort of a paradigm shaping process that has morphed my own understanding of what it means to be a plastic surgeon. So first of all, I went into medicine. For me, it was because my mom had a heart transplant and I saw what the surgeon could do to basically save her life and give her life back. And at that moment, I decided I want to be a person who enhances the quality of life and ultimately improve people's lives. So this concept of doctor, patient, surgeon, patient was really meaningful for me because I wanted to be able to achieve what medicine is meant to do, which is to help suffering, which is to help people improve quality of life and just give people an opportunity to solve their problems. And that often is missed in the field of cosmetic surgery because somehow I think we ultimately think that the problems that people bring to their table are not the same as the medical issues such as tumors and trouble breathing and orthopedic issues and all this kind of stuff. But at the end of the day, when you really understand what it takes for a patient to come to see us, when they come in for, they're willing to take, the recovery, the expenses, all that. This is something that means a lot to them. The changes that they're seeking are something that are profoundly important for our patients. And as a result of that, we as providers owe our patients the opportunity to take care of those issues in an ethical and in a high integrity type of way. So what I learned is, how I learned this, the importance of this is when I was first in practice, there was a patient, and a very endearing patient by the name of Dottie, who came to me from Arizona, and I was in San Diego at the time, and she wanted to have facial rejuvenation. And she came to me, I gave her a consultation. She was very wrinkled, had a saggy jawline and neck, and to me it was a very clear case of a facelift, neck lift, and a CO2 or some type of deep laser resurfacing. And I gave her those recommendations. And she accepted my recommendations and then explained to me later on that for the last 4 years, she's been trying Botox and fillers and this laser and that laser and all these different non-invasive treatments and spent $7,000 or $8,000 of her money. And all she wanted to do was, as she entered retirement, was to look her best and to feel as young as, and look as young as she felt. And what occurred to me right then was that for all those years that she'd been going from this med spa to this practice to that place, that basically people were offering what they could offer her, not what she needed. And that was a major source of skepticism and lack of trust that was being developed over time. And I felt very, very bad for this person because naturally, we all work hard for our money and no one wants to waste it on things that ultimately don't work. And so we had a heart-to-heart, and I gave her my word that these treatments that we're doing are going to effectively treat her problems, and they did. And she was so beyond happy that she had these outcomes, and as a result, literally for the last 10 years, she's been sending me, birthday cards and holiday cards, etc., telling me again how happy she is and how grateful she is for all the things that we did. So at the core of the concept of ethics and integrity comes, we don't ultimately want to offer a patient something that doesn't work. And that's a fundamental foundation in my practice, where if you come to see me, if you have a particular need, I'm going to tell you straight what that particular problem, what the best solution is for it. I'm not concerned about what your budget is. I'm not concerned about what your aptitude is, whether you want surgical or non-surgical. I'm just going to tell you fundamentally what is the best solution for your particular problem. And then it's up to you to decide whether or not you want to have that procedure done. But I'm not going to give you a hot new laser that is touted to lift your jawline or neck or all this kind of stuff, when I know that it's going to take years of research and observational experiments to recognize whether that laser is actually going to be able to do that particular treatment, or that perhaps this is what you want. You don't want a surgical treatment, so I'm just going to give you a non-surgical treatment. This is where a lot of times patients get into doctors that lack of continuity between what works and what the patient ultimately needs becomes muddy. And the core of this is do the treatment that is going to give you the best result. We often say no to patients when we don't feel that we can achieve their expected outcome. So basically turning away patients is okay, and it's a part of our practice. And at the end of the day, it's important to focus on remedying the root of the particular individual's concerns and problems. And if you do that, as an industry, there's going to be a lot more trust. People are going to feel a lot better about the outcomes that they receive, and there's going to be a lot more happiness that goes along with it, because we're treating problems the same way that you do when you go to any other medical facility, any type of medical doctor. So I think these are very, very important paradigms and perspectives to have. Both as a patient, you want to basically be willing to do what it takes to get the outcome you're hoping to achieve, and find a place that you're going to feel that you have that trust embedded into the practice. And as for you practitioners, remember that you might earn the patient's business in the short run, but you'll lose it in the long run if you don't give them what they're expecting and ultimately let them down. So those are the basic foundations of ethics and integrity in the field of plastic surgery, and something, again, that I think should be at the centerpiece of all of our patient-physician interactions. I hope you found that helpful. If you have any questions or comments about this and your personal experiences, please put that in the comment below, because I think this is a very rich and interesting conversation to have, and we can all learn from this.